Hi everybody, this is Kaylee. Today we're going to continue our discussion on STDs by talking about the clap, more commonly known as gonorrhea. Well, what is gonorrhea? Are you at risk? And we'll also discuss how gonorrhea can affect pregnant women and their babies. So, what is gonorrhea? Gonorrhea is a bacterial STD caused by the strain of bacterium called Neisseria gonorrhea, which likes to thrive in warm, moist places. Gonorrhea can appear in the reproductive organs, the mouth, throat, and eyes. It's a very common infectious disease, and in fact, 700,000 new cases of gonorrhea are reported each year to the CDC. And in actuality, this is only half of all cases. Contracting gonorrhea is actually fairly simple. No fluid exchange has to occur, and all that has to happen is exposure to the infected site. So, are you at risk for contracting gonorrhea? Well, if you're sexually active and unaware of your status, then yeah, you're at risk. Most men and women who have gonorrhea show mild to no symptoms whatsoever. Now, for men who are infected with gonorrhea and do show symptoms, they'll usually appear 2 to 5 days after being infected, but they can take up to a month to show up. And if you are infected with symptoms, they can include the following: burning sensation while urinating, a white, yellow, or green discharge from the genitals, or swollen and painful testicles. Ouch. Now, with women who have contracted gonorrhea and show symptoms, they're often very, very mild. Most doctors can even mistake them for a simple bladder or vaginal infection. The symptoms that occur from gonorrhea can include pain in the genital area, increased vaginal discharge, or bleeding between periods. Now, for both men and women, the disease can also appear in the rectum or the throat. Symptoms in the throat are often mild and can be mistaken for things such as strep throat, but when it comes to an anal infection caused by gonorrhea, things such as painful bowel movements, bleeding, or discharge from the anus can also occur, and this is in both men and women. Now, with or without symptoms, if gonorrhea goes untreated, long-lasting severe damage can happen. As we discussed with chlamydia, gonorrhea can also cause pelvic inflammatory disease in women, which can cause things like long-lasting chronic pain, an infection of the fallopian tubes, which can lead to infertility, or internal abscesses of the reproductive organs, which is like a pus-filled pocket inside of your uterus. And for men, the disease can also lead to infection of the epididymis, which are the ducts attached to the testes, causing painful swelling of the testes, and in some cases, sterility. In rare instances, in both men and women, gonorrhea can spread to the blood and joints, and this can be life-threatening. Several laboratory tests can be done to diagnose gonorrhea. However, the most common is called a Gram stain. A Gram stain is done in the physician's office when a doctor will take a sample of the urethra of a man or the cervix of a woman and examine that sample under a microscope to search for gonorrhea bacteria. However, this test generally works better for men than it does for women. After diagnosis, gonorrhea can be treated using several different antibiotics. However, across the world and in the United States, several drug-resistant strains of gonorrhea are popping up, more and more over the past few years, which makes successful curing and treatment of this disease very difficult. Now that we've discussed if you're at risk and what can happen if you are, let's talk about what can happen with pregnant women exposed to gonorrhea and their children. Basically, if a pregnant woman has an untreated case of gonorrhea, she can pass this to her child during vaginal birth. Now, this can cause extreme complications for newborns, including blood infections, which are life-threatening, joint infections, and sometimes blindness. Doctors and the CDC suggest that if gonorrhea is found in a pregnant woman, it needs to be treated immediately to try and avoid these complications. What do your bong, your dealer, and the ensuing political discussion have in common? Join me in our next video when we're going to discuss the word origins of paraphernalia, thug, and chauvinism. Thanks, guys, for joining me on our discussion today about the clap. Well, that's no laughing or funny matter, so remember, use a condom, try and keep yourself safe, and rate my video. leave your comments, and don't forget to subscribe. Thanks. So, what is gonorrhea? Gonorrhea is a bacterial sexually transmitted disease. No. Okay. 1,000 new cases of gonorrhea are reported to the STD, or to the CDC each year. Okay. Or the cervix of a woman. An example. Okay.